5 narrowings of the esophagus. The first one, the point of transition to the stomach pouch. That's one. The second narrowing. This is the point where the esophagus intersects with the left bronchus. This is 2. The third narrowing. The point where the esophagus intersects with the aortic arch. This is 3. Please, the fourth narrowing. The location where the esophagus passes through the esophageal hiatus of the diaphragm. Diaphragmatic hiatus. And the very last one is the point where the esophagus transitions into the stomach, where the sphincter is located. The sphincter is named after the author. It is called Gubarev's valve. And what does clinical anatomy entail and involve? Dear students, the esophagus is an organ in the mediastinum. Nearby are other organs. That's one. In close proximity are the cellular spaces. In the event of a disease like mediastinitis, inflammation affects all of these cellular spaces. The esophagus is located in close proximity to the bronchus. There can be esophagobronchial fistulas, which are connections. Esophagobronchial fistulas. Alternatively, there may be esophageal diverticula, such as lateral protrusion. Here goes the esophagus, and there is such a bulging. Imagine food passes through, enters this bulging structure, and stays there. It stagnates, putrefies, ferments, and then through the tissue perforation, the contents reach the mediastinum area. Purulent mediastinitis. But what are the most common types of lesions? So please proceed to the next slide. This is the esophagus. If there is any question about cancer, feel free to ask. Cancer is cancer. The occurrence of cancer in the lower part of the esophagus is more common, as it is where Gubarev's valve is located. In this department, if you would, please, can you tell me the precise location of this sphincter? It should be closed at all times, and the pyloric one should also be closed. Here, we have an acidic environment. Proceed to the next slide. We will reach our destination now. So, kindly note the incompetence of this valve. This is the first and second time. Hernia of the esophageal hiatus of the diaphragm. Hernia is organ protrusion beyond normal boundaries. For example, there can be umbilical hernia where intestine protrudes through umbilical ring onto abdomen. Inguinal hernia there, and so on. Internal hernias require the organ in the abdominal cavity. However, they can extend beyond these boundaries, reaching the diaphragm and entering the thoracic cavity, violating the limits of the abdominal cavity. As an illustration, the lower portion of the stomach, this very same spot, the lower portion of the stomach, it traverses through the esophageal hiatus. Where exactly? In chest cavity parallel hernia, placed here, but precisely cauterized and nerve supplied, venous outflow, vessels compressed, nerves, venous outflow obstructed, that's all. Perforation. And where does this content go? Into the mediastinum. Please, purulent mediastinitis. On the next slide, please. And here is a closer look, please, showing the normal esophagus. And here is the peritoneum. Look how gradually the hernia at the esophageal hiatus. There are stages like, you see, here you go. The stomach enters. Here there is nothing good. Sliding hernias of the esophageal hiatus of the diaphragm can also occur. Meaning of skolziaschi, person standing, hernia gone, means it moved into abdominal cavity. Everything, it went here. The person lay down. Again a hernia, that is, the bottom of the diaphragm. The stomach enters the abdominal cavity through the esophageal hiatus of the diaphragm. Sliding hernias. So what should be done? It is necessary to strengthen this area so that it does not protrude. That is plastic surgery. Plastic surgery of the esophageal hiatus of the diaphragm. So, the next slide. Students of RAME, tumors, cancer, esophageal involvement, tumors, cancer. For instance, there could be chemical, like a burn, structural narrowing of the esophagus, stenting to keep the lumen always open. And here, please, a creeping, menacing esophageal tumor like this. Can you see it? Throughout all of the walls. That is where you need to go. Please proceed in that direction. It's spreading. So what should we do? The only salvation is to perform a resection, to remove it. Esophagectomy removes the esophagus. They removed. Understood. But before removing the esophagus, it must have its own beauty, innervation, wine, connoisseur. Crucially, preserve the intersection, ligate esophageal arteries from the abdominal aorta, from the abdominal section, so to speak, right? Here are all the arteries that cross the esophagus. Everything is tied off in advance. This is one. Second, the next stage. Look here carefully, like this. Esophageal plastic surgery. No esophagus. Where to take from? Segment, colon. Area. Look here. This is a section of the colon. Filatov's flap is formed on vascular pedicles, maintaining a specific connection, let's say, through arterial venous anastomosis, that is, venous blood supply. Following that innervation, please be attentive. Here is the plastic surgery procedure. And they connect to the boat precisely with the stomach. Please, instead of the esophagus, plastic surgery was performed precisely with this section of the colon. Or what actions do they take? They execute a surgical procedure known as boat-shaped stomach resection. Here it is. This is how they resect the stomach. This part is stitched up. Then a boat is constructed from the greater curvature of the stomach. Here is the boat that is formed. Then proceed to fold it into a small tube. Due to the significant curvature of the stomach, it takes on the form of a little tube. This particular part remains in its current position, while the second part is connected to the pouch located in the stomach area. That's the kind of plastic surgery. Plastic surgery of the esophagus using the colon, the small intestine, and the greater curvature of the stomach. There is no way out. There is no way out. Somehow, from one's own tissues, from one's own organs, this is how these organs are restored, dear students, with such plastic surgeries on internal organs. So, the next slide.